Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. All right, welcome back to the Equine Vet Connect podcast here at Countryside Equine Hospital. Got Dr. Brown with us, Dr. Caitlin with us today. Exciting episode.
Woo-woo.
50th episode we recorded. I really didn't know that we'd be going this long, but it's been a lot of fun, and we're going to keep recording. So, big milestone for us. We've had 50 episodes.
People have wanted to listen to us 50 times. That's
50
crazy.
times. This is awesome. So, today we're going to do something a little bit different and celebrating our 50th episode. We're going to do Vet Connect Trolls the Internet. So, we're going to read through different things that have popped up in Facebook feeds, on the Internet. And we're going to go through, and the big point of this episode is why you should call the vet and not go to social media to find your answers. So in honor of our 50th episode, we're going to do a Dr. Facebook Will See You Now. We're going to troll the internet. And we're going to look at all the things that people post on social media, because if you have a question about equine medical care, the best thing to do is go straight to social media, not call the vet.
Yeah.
So people
Get
that
all
spent
the best
their
advice on Facebook.
And
Yeah, I
Reddit.
mean-
I'm a big Reddit fan
Reddit,
myself.
yes.
I love some Reddit.
Yes, so we're gonna go through why maybe Dr. Facebook should probably go to school before he gives vet advice. So let's jump right in. What's our first one we got up here? Let's see. This is a post. There was a post the other day about studs being on Regimate to be shown. But what about mares? I was shocked to hear about a big trainer in my area requiring all his mares in the barn to be on it. Is this common? No. I think, here's just my thought.
Oh my God.
Don't just throw something on a medication because...
Especially a hormonal drug that changes a lot of the reproductive physiology and behavioral physiology of an animal. And also, Regimate is not you have to be careful if you're a woman handling it. So you don't just willy-nilly throw it to everybody in the barn.
Well, and the issues we've seen, Dr. Brian, you do a ton of repro up here.
I do.
The issues we have seen this spring, I feel like a Regimate has been an issue in a lot of cases.
We've made the joke that I spend my career trying to get mares to cycle normally while as other vets try to get them to stop cycling.
Yes.
But the problem you get into is that mares are seasonal polyestrous. They're not cycling all year round. So
Yeah.
when we are giving them meds to try to manipulate a cycle that isn't there all of the time and goes through transition periods, that's when you start, trying to play God, and you can really screw these mares up.
Yeah.
And instead of turning off their cycle, they'll try to fight back.
Yes.
And now you've got anovulatory follicles that are just pumping out tons of hormones, and that's going to mess them up. You've got these mares that can't cycle at all.
Yeah.
Or are cycling so frequently that we can't even control it anymore.
Yeah, I agree. And I think my favorite thing on here, there was questions about if it was a reputable trainer, and my favorite part of this post said, I only said he's a big trainer. I said nothing about reputable. I think that might be one of the greatest
I feel
statements in
if you're
Facebook.
making that comment, then why do we even have to ask the question? If you know that the person's not reputable, maybe don't do what they say.
I mean, I've got some mares that are on Regimate.
Oh yeah.
Yes.
I've got some that are on it so they can show and be dealt with. But we have a plan in place. We cycle those mares. It's done under veterinary guidance. We're not just it's got a uterus, ovaries, here's Regimate.
Yeah. It's not just a blanket
No.
Right.
treatment.
So let's have a reason. So
Oh man.
Why, if you're I don't even want to deal with mares, then why do you have mares?
Right. Just get a gelding.
Just get a gelding. They got their
Yeah.
own problems.
So Yeah, so I think bottom line there is have a reason. If you're going to use any medication, my favorite statement ever is surgery's trauma, medicine's poison, alternatives are witchcraft, absent a diagnosis. Have a reason for everything you do.
And if you're an owner and your trainer is pushing you to put your horse on this medication, you do have a right to ask them, what is the reason
Yeah.
for this? And if they have a good medical reason and a veterinarian diagnosis to back it up, then absolutely. But if they're just putting your horse on a medication and they don't have a good reason, then you have a right to question that. It's still your horse.
Yep. So I think, talk to your vet.
Talk to your vet.
Talk to your vet.
That's what
Because
we're
like I
here
said,
for.
Do we have some of these mares that are on Regimate? Absolutely. Are they managed? Absolutely. Like this is something that we're watching and we're paying attention to. Like there's a lot of things that go into it. So just willy-nilly, here, have some Regimate because you have an ovary. Not a great idea. All right. Purchased a beautiful, put-together foundation, 10-year-old Acacia mare. She's proven but retired early due to an injury completely unrelated to her conformation or performance.
Okay.
I just got back her 6-panel test, and she has 1 copy of G-Bed. Fully aware it is a recessive disease and 1 copy does not affect her, is it irresponsible breeding to continue to cross her with my 7-panel negative AQHA stallion? This mare is stellar, and I hate to be seen as breeding irresponsibly given this. She is wide, stout, correct, big boned, and footed. This is the only negative about her. Well, I have a couple things here.
Oh, man.
My big one, the mare got injured, and we're breeding her.
Yeah.
If you want to know what's wrong with breeding in the U.S., our thought is if it gets hurt or injured and it's a mare, at least I can breed her. Maybe there's a reason. Just because it has a uterus does not mean we need to breed it. And maybe these ones that are chronically injured, maybe we don't need to continue. I mean, I look at it this way. I tell people this all the time. I'm just honest about it. If you're married, like if you're constantly breeding the horses that don't hold up because they have a uterus and you're constantly breeding those horses, that is fantastic for me. I got kids. I got to get them through college. Like, this is great.
Those
Straight
babies
up.
are gonna continue to break down.
Yeah, it's like how many of these come in where I find out like, well, this mare's hurt, but her mare was also retired for the same thing, and her mare before that, and they're like going to breed her, and I'm like, fantastic! I got kids to get through college. This is great for me. I do not understand this thinking.
No. I
Other-
also just like if you have a chronic painful injury, I don't want to carry around a baby for.
Right.
You know.
I'm like, if it's a serious enough injury that you've been retired, that you can't perform. They said it's unrelated to her conformation or performance injury. So I'm like, let's say maybe she got wrapped up in a big thing of barbed wire and her leg is the size of a tree trunk or something. I don't know. But like that, to me, you start carrying around the weight of a foal and trying to nurse a foal and raise a foal, that's going to potentially inhibit that.
Well, yeah.
Kudos to this person though that made this beautiful comment at the bottom. It is a personal choice. Some people don't care about purchasing a foal or horse with a copy. Others will not even look twice. I won't buy a breeding potential horse, mare, or stallion who is a carrier. That's my personal choice. It is my goal to produce foals that better the breed and not just be average. Buying a gelding possibly depends on what he is and what carrier.
I mean, that makes sense. You're not going to breed it. I mean, my thought is if you're carrying a copy of this, even though it's a recessive trait, if you're carrying a copy, let's don't breed those.
Yeah.
Correct.
Let's get rid of this.
Yes.
If you haven't seen G-Bed, and if those of you wonder what G-Bed is, we've got an episode out there that goes through all these genetic conditions. It's a horrible condition.
Yeah.
They're not going to live past a couple days.
No.
If they live at all.
Yeah.
Let's get rid of this.
Then
Yes.
they go on to say that they're like, I want to eliminate anything I can have control over that is a negative, and a carrier of a genetic flaw or disease, even if it is recessive, is a negative and something I wouldn't want to produce. Absolutely.
Yes.
Yes. And yes, you have a 50% chance of that foal being a carrier, but you also have a 50% chance of it not being a carrier. I don't like those odds.
Yeah.
No.
Don't perpetuate this.
Yeah.
Like, I know she's a nice mare. There's a lot of nice mares out there.
Yeah.
That aren't carriers of fatal diseases.
Yeah.
If you could breed her once, the foal is clean, you like the foal, keep breeding her. I don't know
on.
much about genetic diseases and such. There's your answer right there. That's all you need to know.
I don't breed horses.
I'm just following to learn. I don't breed horses. Okay.
I love this person.
Yes.
This is laying all out on the table.
Yeah. If you breed her once, I mean, it's a recessive trait. You don't know which copy. Like, guys, that's not how this works, right? The next time you breed, it could pass on the gene. Maybe
Yep.
the time it doesn't.
You may get 3 foals and they all are carriers.
Yes.
You may get 10 foals and they're all carriers.
But at least that one, at least that person put their qualifications out there. I really don't know what I'm talking
I don't know what I'm doing.
about.
I'm just here for the conversation.
I'm here to learn.
I appreciate that.
Yes, love it.
That's what Facebook was meant for. It's just
Yes.
people that are like, I don't have horses. I don't know anything about genetics. I'm just joining the conversation.
I'm just here.
Throwing it out there.
But this is what I would do.
Yeah.
All right.
I love that.
What does everybody have their horses on for sore hocks and stifles? Currently using Osteomax, but want to see what else works for others. Also, has anyone used Boswellia, Devil's Claw, or another natural remedy with success? Bless it.
Herbs and spices.
Yes.
Great for the kernel, not good for medicine.
Got Adequan on there a couple times.
Yeah,
That's
that's good.
good. We've got some research
like
backing that
Adequan.
up.
Yep,
Cosequin.
Yeah, I think the
Fan
thing to
of
remember
Cosequin.
every time we get into naturals is how little research is done.
Yep.
Do I think there's some natural products out there and some herbal stuff that is good? Absolutely.
Yeah.
Yes.
But let's make sure we got some actual science behind it, because now I'm gonna date myself. But back when I was in college, the whole rage was St. John's wort,
Oh, yeah.
and it's supposed to make you smarter, jump higher. Like, it cured everything. St. John's wort was the magic. Well, it turns out if you take it for long enough, you get this raging photodermatitis.
Oh.
Like your skin just burns.
Yeah.
But like, it was all the rage. Like, every time you turn on the commercial, you had like ginkgo biloba and St. John's wort. That, you take those two things, your memory's going to be great, your liver's going to be great, life's going to be good.
Until your skin falls off.
Yep.
And it turns out you get a raging sunburn. So let's be careful with natural.
Yes.
Everybody always says it's natural, it must be good. I like to remind people, so is cobra venom.
Yeah, that's true.
That's
Cobra
true.
venom is 100% natural.
Well,
And poison ivy.
yes. And the supplement industry has absolutely no regulations
None.
whatsoever. There is no governing body that's saying you can or can't put this on your label. These are the amounts that you can have in ingredients. There's no research to any of this.
No.
So people can put whatever they want on a
They
label.
can make any claim.
They can make any claim, and your body's only going to absorb what it needs.
Right.
So if there's, thousands of milligrams of this, say turmeric or something in there, your body's only going to take in what it needs, and the rest of it's going to get pooped out.
Yep.
So
Yep.
I always tell people, I'm like, you're making expensive poop with
Yeah.
a lot of these.
Yeah.
Yes.
I'm not saying it's not going to work, but if you're on a budget, let's maybe direct our focus to things that we do know work.
I
Correct.
agree.
Yep.
I agree. Does anyone use glue-on shoes? Pros, cons, good or bad experiences? Yes, Easy Care Protected Hoofwear are hands down the best. As long as the hoof is prepped correctly, you shouldn't have issues losing them. I keep my mare on a 4-week cycle. They're far less harsh on the horse's legs than steel shoes.
Spelled incorrectly.
The owner of Easy Care is a very intelligent, innovative individual. My farrier is able to speak directly with him if he's in need of guidance or has questions about his products. He also has developed shoes that can be put on with super glue.
Interesting.
Okay.
I've learned one thing is that if you want to get a farrier to not like you, tell their client to put glue on shoes on.
I think and I'm speaking as a farrier now, every farrier has put on glue-on shoes. We all know that at some point in time we need them. And you can actually go back. There was a book written in like 1896, I think. It was called Dollar and Wheatley's Handbook of Horseshoeing, and there's actually a recipe in there for a glue to hold a shoe on a foot.
Okay.
So this
In the 1800s?
1800s. Dollar and Wheatley wrote this book.
Wow. Do you have it?
I've got a copy somewhere. And I can't understand what the recipe is because it's like weird words that I just don't know what they mean. So it was like this recipe, you mix like 3 parts this, 2 parts this, blah, 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 and then you like glue the shoe on. So, I mean, it goes all the way back to the 1800s.
They were using horses to make the glue that they then used to glue
Prob-
the shoe on.
Probably.
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 Actually, yeah. Irony.
It's recycling.
Full
So,
circle.
here's my thing. Like, we've all used them, but the comparison I use is you look at your fingernails after you've been wearing the epoxy or acrylic nails for a long time.
Mm-hmm.
Look at the quality of your nail bed.
Yeah, you can look at mine right now. Brittle,
Yes.
breaking, sad.
So, is there a place for them? Yes.
Yeah,
Yes.
Does every horse need to wear them?
all the time.
Maybe not. And what you need to always avoid blanket statements. Like I used to be the one that said, "Never glue a shoe on. Glue is terrible. Don't ever do that. I'll never glue a shoe on." Until the day I had to glue shoes on,
Yeah.
and I was like, "Okay, there's time and a place."
Yeah.
But be careful, like blanket statements. Like,
I feel like this whole trend, there's a whole trend coming along with the glue-ons and the barefoots and all that, and how it's so much better. But I'm like, being a blacksmith is like one of the oldest professions
Goes back
in the
to
modern
tubal
world.
cane.
I mean, it
Yeah.
is. I'm like, we've been doing this for a long time.
like I said, there's pluses and minuses.
Yes.
I mean, is there times I still glue a shoe on? Yes.
Yeah.
But I don't think that's where we need to be all the time.
All the time.
Like I think you gotta think through. Again, it's like the regiment comment. Let's look at the individual. Let's look at the situation. So,
Looking for the top of the line gut supplement, considering Raylene GI or Poseidon Animal Health Digestive HP. Thoughts? No gut X. Woo! Okay, Platinum Performance GI is listed in there. Vitalize.
I haven't heard of any of these.
The only one that I've heard of is the Raylene GI.
Yeah.
yeah, I've heard old Reline.
Yeah. I never say that one right.
Reline? Is
Yeah.
that how you pronounce it?
I guess.
Relny? Reline.
I hate the word gut.
Relining.
I always hate this question, like gut supplement, GI supplement.
There's a lot of different sections of a horse's GI tract that do a lot of different things.
What are we trying to do here?
Yeah. What's the
That's-
goal?
That's always my $1 million question.
Yeah.
And also, like, what's wrong with the GI tract?
Because even within the stomach, you have two very different sets of ulcers that you're going to treat differently.
3, really.
Well, yeah, that's true. So, like, what's the goal? What are we trying to support? What are we trying to fix?
Top of the line.
Top of the line.
Top of the line.
Well, I think what you run into as well is, I swear, like, how many times have they been dealing with something for like 4 months? And they've been on every supplement in the world out there. They've spent thousands of dollars.
Change their feed.
Finally
couple
come in.
times.
And turns out, like, there's some quick fix. Like, once we figure out what's wrong with it, we just go in and fix it.
Best-
Best cheaper tricks for ulcers, not ulcer guard.
Ah! Okay.
You light a red candle under a full moon. It's in Venus.
You do some Reiki around
Yeah.
the stomach area.
Bad news, guys. Only one thing that works.
Oh,
Otherwise,
Some people said that.
gastrocard is the only proven thing that works.
correct.
Yep.
Yes. That's actually a vet that wrote that one.
Is that a vet?
That's a vet. I know her.
Go you.
She's a friend of mine. Thank you.
Yeah, gastro/ulcer guard is the only proven method of treatment. It is far cheaper to go the proven route than try a million internet myths.
Retweet. We love you.
Yes.
Sure enough. I do, though. We have to have this conversation with a lot of people every time. That's like the most cost-effective way to treat ulcers is to accurately diagnose them with a gastroscope, treat them appropriately, and recheck at 30 days.
Yes.
That is the most cost-effective way to treat. Is to
Knowing
use stuff
which
that works.
ones, knowing which kind of ulcers you've got, how you need to go about treating them, how long you're going to need to treat them for. That is the most cost-effective way. Like, if you look at half of these supplements out there, by the time you stay on for 6 months, you haven't done anything.
Cayenne pepper and slippery elm powder.
Oh,
That's interesting. Metamucil powder and feed. If you've got sand, sure, but ulcers, that's not going to fix it.
No, Metamucil does nothing for ulcers.
No.
no.
707 ulcerless. Oh. Here's the other thing.
Ooh, the word cheap and ulcer treatment or prevention don't go in the same sentence, sadly. Yeah.
Yeah.
Sure enough.
Lifestyle changes, absolutely. Let's-
There's things you can do to minimize your risk, but when it comes to treatment, there is only one thing that works.
Yep.
Yep.
That's it. And if you're looking for like a cheaper way, I don't, like you said, the cheapest way to do it is do it right.
Yep.
Right.
Like you say all the time, Dan, the most expensive drug is the drug that doesn't work.
Yes. Omeprazole powder, compounded omeprazole. This is, all right, this irritates me, right? Omeprazole is completely destroyed in an acidic environment, i.e. the stomach. Once it's the stomach, it's destroyed. The medication never works.
Because omeprazole has to be absorbed in the small intestine to actually get, it works on the backside of the stomach. So it has to go get absorbed and then go back to the stomach via the bloodstream. So if it gets destroyed in the stomach, it can never do its job.
I mean, I tell people all the time, like you can sprinkle it on their back or give it to them in the feed. Either way, it's going to be fine. It's going to do the same
It's gonna do
thing.
the same thing.
Put it directly in.
And like we won't sell it here. Like I will not sell compounded omeprazole. We won't write the script for it because again, it's the most expensive medication is the one that doesn't work. So when you want to talk about cheap, I think this is where we got to go back to and say, okay, we're going to make wise decisions with money.
Yes.
Yeah.
All right, it's not about what's cheapest; it's what's the wisest decision. And compounded omeprazole or omeprazole powder is not a wise decision.
How do we feel about the aloe vera juice? It's coming up several times.
I've seen that a lot.
So this goes back to a human paper done, I think, somewhere. I feel like it was done at a South African university. Anyway, it was one paper that showed aloe vera juice would help out with stomach ulcers in people. That study was later repeated like a multitude of times and has shown no efficacy whatsoever. If you try to find one on horses, good luck. Like a true peer-reviewed scientific paper.
Yeah.
Because it all goes back to one paper published on the human side saying it worked. And since then,
Nothing.
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 So there was a magical moment in time where the stars aligned, and I guess aloe vera juice must have worked. 'Cause there's no way somebody
No.
made up data.
And horses have an extremely acidic stomach compared
yeah.
to humans.
Yes.
Our physiology is not the same. So if something does work in humans, that's why the little omeprazole caplet things that everybody takes are like, just put them in your horse's feet. No, it doesn't work.
Well, and like when you get in like baking soda, it's a buffer. A horse's stomach continuously produces stomach acid all day, every day.
Your little teaspoon of baking soda once is not going to cut
No,
it.
working
it helped
hard.
out for about 15 minutes.
Yeah.
Yeah.
And the stomach's like, and
I'm out.
If you want to do a buffer, things like alfalfa, which is high in calcium, can help.
Calcium carbonate and
Yeah.
alfalfa breaks
Yeah.
down, does help out with some buffering capacity.
great.
Nature's tough.
Interesting fact there, though. Do you know that's never actually been proven?
The alfalfa?
Nobody's
Really?
ever done a study on it.
Really?
We assume
Yeah.
because the type of calcium that's in there is calcium
Yeah.
carbonate. Calcium carbonate, you know, is Tom. So we assume that as it breaks down the stomach, it releases calcium carbonate and acts as a buffer.
Yeah.
But that's one of the few things that we talk about that there actually isn't. There hasn't been a controlled research study on.
Somebody needs to get on that.
So
Okay, this esomeprazole, I've been seeing this pop up in a couple different places. There is a paper somewhere. I need to pull it out. Maybe we'll do that for paper this week.
yep,
Because
esomeprazole.
I've seen a lot of people talking about it on social media. And I
There's a-
haven't deep dived into it.
There's
so.
a commercially available form in Europe of esomeprazole.
Yes.
For horses, and it is a more
Yes.
potent. Esomeprazole and pantoprazole are more potent inhibitors
Mm-hmm.
than regular omeprazole. Yeah, your $1 million question is because this is the part everybody's got to remember. Like, when you give these medications, do they reach a therapeutic level in the bloodstream?
Mm-hmm.
And that's what we have to know.
I always like these comments when they're like, I feed this, this, and this. He has no more ulcers. I'm like, how do you know? Did you get him scoped?
Did you scope?
Because
Yeah.
that's the only way you know. Oh, gosh. Okay.
Yes.
Oh, boy. Oh, boy.
Lord, why we got to go there? Favorite hind gut ulcer treatments and preventatives.
Soapbox, go.
One paper, Louisiana State, Frank Andrews, describing right dorsal colitis secondary to NSAID administration,
Which we know happens.
which we know happens, but has kicked off a multi-million-dollar industry with no actual proof that these things exist.
Colitis,
Colitis is real. Right dorsal colitis is real.
totally
Yes.
real.
They get
Inflammation of
huge
the
blowout
colon.
diarrhea.
Yeah.
Hindgut ulcers,
Oh man.
I believe it's a myth because no one's proven to me otherwise. Now, can you have some fermentation issues in the hindgut?
Oh yeah.
Can you get more acid producing bacteria back there? Absolutely. Can you probably lower the pH? Sure. But again, we don't know much about this. Nobody's proven these hindgut ulcers actually exist in just normal horses.
Yeah.
What's an activator pill? What my favorite is an activator pill that you give your horse 2 a day, then bump down to 1. Supplements do not get fully absorbed. That's why I recommend an activator pill. What is this activator pill? I'm curious.
This is magic.
I want to know.
You little activator pill.
Is it, what else? What else does it do? What else does it activate?
Oh, hindgut ulcers aren't a thing. Dr. Ben Sykes, the leading mind on ulcers, explains this in his video on YouTube. If what you're seeing is hindgut acidosis, which is likely stemming from a diet higher in starch and lower in fiber, bing, 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 bing.
100%. I can believe and get on board with hindgut acidosis.
Yeah.
Like I was a ruminant guy, right? When I was a nutritionist, I was a ruminant nutritionist. We dealt with ruminal acidosis all the time. We'd mess these diets up.
Yes.
So yes, I believe that. But the actual ulcerations, I ain't buying.
No.
I ain't buying it. And like I said, if Ben Sykes says so,
I'm gonna believe him.
I'm believing him. Dude's a nerd, cool nerd like Ben.
Hindgut ulcers aren't real. Yep.
Who said that?
This,
I love this guy.
It's most likely inflammatory bowel disease or something like it. Glandular and squamous ulceration are the 2 ulcer types in the stomach. Get those under control and work on your feed/nutrition regimen for the horse. Woo woo.
I'm glad you're a top contributor.
Good job,
Great
man.
job.
Good job.
Yes.
Person.
Nothing drives me more crazy than hearing about hindgut ulcers. I'll be real honest with you because, like I said, I hate. Like we said before, the most expensive medication is the one that doesn't work. We always talk about you need an accurate diagnosis. We talk about let's make wise decisions with our money. Supplementing for hindgut ulcers, a condition that doesn't exist, not a wise use of our money. Let's go like practice some medicine. All right, I feel like I held it in pretty good.
That was good.
That was
You
good.
did
You did great.
I
Yeah.
felt like
You did good.
I don't know why. That's just like I don't like seeing people taken advantage of.
It triggers you.
I don't like seeing people lied to, and I feel like a multi-million-dollar industry's been built around a condition that doesn't exist.
Yeah.
This is like restless leg syndrome of horses, I think.
Restless leg syndrome.
I don't know.
What are your favorite treatments for fungus? We've never had issues with it before, but I have one horse in my program that has popped up with it, and I'm having a tough time clearing it up. Yes, she does have her own separate cinch and brushes.
It's not a fungus.
It's not a fungus.
It's not a fungus. Everybody thinks it's a fungus. It's never a fungus. It's a
not
bacteria.
Yes.
Never a fungus.
It's never
they're like,
a fungus.
Oh, I have to get this antifungal shampoo, and then they get 10 different shampoos, and none of them have an active ingredient in it that's actually going to work on what you're trying to fix.
You've scrubbed your horse
Raw.
and you've now disrupted their skin microbiome.
Even
and now
more.
they have a worse pyoderma because you've disrupted the balance of everything. And
Gone on Facebook and learned about everything under the sun that you could possibly put on the skin, from kerosene to whatever herb and spice, and like that's one of the chlorhexidine.
this first one doesn't make sense. I make sure to take the scabs off to expose to air and then put diaper rash cream in the open areas. Like,
Jock itch
you've
spray.
contradicted yourself. And
Orange
What is
mouthwash.
jock itch spray? Is that like
It's an antifungal.
for
So it's like athlete's foot.
Okay.
It's like athlete's foot of the.
Is that what they spray in the bowling shoes? Like when you like.
I think. So. And again, like this is what drives me nuts, right? So we get called
Orange
out.
mouthwash for everyone.
Okay, and
Orange
also,
mouthwash.
yes.
This is the, oh, I love this comment.
wait.
This is great.
And then I tried MTG before this and didn't see much of a result besides him being super oily. Please stop putting MTG on your horses if they have freaking dermatitis. Stop it.
Stop that.
Stop it.
You know what step number one should be if you're dealing with dermatitis? Like I don't know, call the vet.
Yeah.
Yes.
Because I can't tell you how many times we go out and we find out we've been dealing with this for 3 months. what started out as a really mild dermatitis, and after they thrown like Listerine, kerosene, all the scenes, chlorhexidines, the skin is in a horrible place. We've
Because
killed
you've-
off all the good bacteria.
And you've stripped all the oils, and you have
Yes.
just disrupted everything. You've made a ton of micro trauma by scrubbing at it.
And I go in there and I try to get like a sample of it, and it's just gooey
Yes.
and oily. And I'm like, what in the world have you put on this thing?
And they're like, here's a list
Here's
of
a
20
laundry
things.
list.
And I'm like, cool. What was the most recent thing that you put on
I
this?
was like, okay.
Soap and water.
Oh,
Notice I did
water.
not say antibacterial. I didn't say antifungal. I didn't say anti like whatever. I'm talking about some straight up mild soap. And I swear, y'all, I've got to do this. I'm going to start packaging up palm olive and calling it Dr. Dan Showglow.
Nice.
And I'm going to sling that stuff because it's magic. You know why? Because like I remember watching my grandma, she watched them stories. You know, every day she watched them stories, and they had them commercials on there, and they're talking about wash the sink full of dishes, not dry your hands. You know what? It doesn't strip the oil off your skin. You need those natural oils on the skin.
If you just restore the balance back to the skin will take care of itself.
Yes. No MTG.
No MTG. Ugh.
No MTG. No chlorhexidine.
Oh,
No
man.
No
chlorhexidine.
iodine, none of that. Oh my god.
Okay.
The waxy substance. All right. We have a 13-year-old thoroughbred mare that foaled a few years ago. Her lower legs were coated with a waxy substance for some time after that, and that seems common for the situation. Her lower hind legs are now coated in this crusty stuff. It is not present in her pasterns. My daughter's tried scrubbing on it during baths and hasn't loosened. We are in very dry Wyoming. She is not stalled, and it doesn't seem to bother her. Any suggestions on things to try to see if it responds? I think I forgot to point it out to the vet because we've seen it for so long and her legs are dark. Step one, the vet obviously was there. If it means enough to post on Facebook, point it out to the vet.
Yeah.
We're here to help.
Scrub a leg clean with soap, okay?
Liking it, liking it.
Put the corona ointment. I'm not.
Blue coat, no blue coat. No blue coat. Two things I wish I could ban: Ictamol and blue coat. Oh, blue coat. Nothing good comes from blue coat.
But I get these photos of people that send their horse in and they've been like coated in blue coat, and my first thought is always it looks like gangrene.
I use a combination of triple antibiotic cream, athlete's foot cream, baby diaper rash cream, and hydrocortisone. That's a lot of stuff, doing a lot of different things.
Yes.
I feel
Hold
like
up.
all those, they're probably all working against each
Yeah.
other. Mix together thoroughly and coat the area. Don't do
Ah,
that.
Listerine.
Iodine, it's a fungus.
It's not a fungus.
It's not. Don't. Listerine. No more Listerine on horses.
Please.
No more Listerine. I remember James Orsini said this. I think it says best. If you won't put it in your eye, don't put it on the skin.
Ooh, that's good.
And Jim Orsini's not a dumb man. This is a pretty smart dude. I think that's a great.
Warm
great
soapy
thing.
water and curry comb.
Used motor oil.
Used. Why used?
Oh no, Canon keratosis. You can Google it. Don't do that.
Don't do that. Use
Also-
a non-medicated gentle shampoo. Okay.
Like that. Equidermal lotion. I'm okay with that.
Don't pick off the scabs.
It
Go
can
with
also
that.
be genetic, so keep that in mind since you said she foaled, and I'm not sure if you plan to Oh my gosh. Okay.
It's
Everybody also likes the equidermal
I
lotion
learned the
a
hard way.
lot.
My horse got cellulitis.
You know, I think that here's the deal. If you've had bumps on there for years, you know what we need to do? We need to figure out what those bumps are.
Yeah.
Like when this starts going on for a while, and you know, it's really easy. We got these nerds called pathologists.
Oh yeah, they're
We
lovely.
just get a little piece of that tissue, and we send it off to nerds, and they send you a report back like, oh, this is what it is.
Yeah, and I'm like, cool, okay, great.
Thanks.
Now
Yeah.
we can fix it.
Now we go fix it. It's really easy.
Oh man. Oh boy.
Eyeballs. Oh God. Okay.
All right, my 2-year-old just saw the vet yesterday and is currently being treated for his eye. However, this is the second time it's flared up in about a year, and I'm concerned with what is going on to be like long term. The vet recommended permanently putting him on aspirin. I've read up on it and I'm still undecided about the pros and cons of doing so. Are there any dietary needs, recommendations I should be focusing on? I also read that it could potentially lead to blindness and was wondering if anyone had experience with that happening or what it will look like. I was hoping to make him into a barrel pole horse. He's not started under saddle and is on turnout and light round pen work. I absolutely love this horse, and I'm looking for some guidance on what I can do to help him and what steps I could be taking to have the best future together. All right, we did step one.
Call the
We
vet.
called the vet.
You didn't like what the vet had to say, which is fine.
Yep. I'm not real sure what aspirin does for uveitis.
It doesn't.
Okay, I didn't think it did.
No, but as I'm here with the, if you don't like what your vet has to say, you're absolutely entitled to a second opinion.
Correct.
I'm not, and I
Yeah.
don't know where this person is and what their options are. Maybe this is the only vet for the next 6 hours. I don't know. But
Dr. Facebook is not your second
No.
opinion.
No.
this, just based on what these pictures are, I mean, I see some hypopyon up in this picture. I can see some flaring in this picture. This horse definitely has some sort of severe uveitis going on.
Yeah.
And that is going to be,
And it looks to be both eyes because
Yes.
that picture is.
is that that's a left eye.
Oh, no, it's
that's a
both the
eye.
left. It's all the left.
It's all the left eye. Okay.
So what does Dr. Facebook say? I'm not ready to read this.
Oh boy.
Oh, boy. Oh, boy.
I like that one. Prescription drops from the vet and all medications. Yep, that's what we need to do.
UV fly mask.
That's a good
That's
one.
good.
I don't know.
Why are
It's
there answers?
Is that all we have?
There was one that said, yes, this
Make
one.
a saltwater wash. Put it in a syringe and spray it on the eye. Make it really salty to taste like ocean water. Do this every day until it clears up. I'll give this a try. Don't give that a try.
no, don't.
Please don't do that.
This is bad.
Please do not put salt in their eye. Oh my god, that is. Oh my god.
I mean, there are times where if you have a lot of corneal edema, we will use hypertonic saline
Yes.
to draw some of that out. But we didn't go get some table salt down at the Walmart, mix it up in some water, and like spray this and that. Like, if you want to put it in your eye, don't put it in there.
No, please don't do that.
Salt water.
We do use a saline as an eye wash, but it is a isotonic. It is the same
Yes.
level of salt as their eye, so it's not going to be affecting that. But oh my god, please don't put salt in your horse's eye.
Don't do that.
Please don't do
Don't.
that. You are gonna really, please don't do that.
Make it really salty to taste like ocean water.
Oh girl, okay.
Great for pasta, not so much for eyes.
Oh god, okay.
Just don't do that.
No. Please
Also, I didn't know that there were like levels of contributors. There's like a top contributor and a rising contributor and an all-star contributor. I did not know that was a thing.
Oh man, this all-star contributor needs to have her credentials checked.
Correct. Yeah.
I mean,
We like
Oh, girl.
drop her down a couple tiers.
I just
Yeah,
want to know that they
for
put
real.
like, hey now, you're an all-star.
You get a little theme song. Ooh, summer sore.
All right, summer sore or dumb baby wound caught on the fence. Treatment. If thought summer sore will be reoccurring, use scarlet old-fashioned stuff and put on sulf antibiotics.
Or dumb baby wound.
Call the vet.
Call the vet.
We can figure that out.
Ouchie.
See what we got in here.
I haven't even looked and seen, are these the same contributors like on each post? Like I have not been paying attention, but I want to know if it's the same like 3 people that are like given medical advice on here.
You got a lot of debates on scarlet oil. Talking a little bit about Vaseline.
Looks like he's playing lip tag.
And lost. Manuka honey.
backbone, sheep dip.
Sheep dip.
She did a thing in this group. I saw on like 6 different pets.
I mean, there's a brand of scotch called sheep dip.
What
on
is sheep dip?
Vetricin.
Summer sore, silver spray, dewormer. Okay, yeah, dewormer. That's your key.
Make
to
sure you
summer
have
sore.
tetanus in your
Yeah.
vaccine schedule. That's good. Yeah.
Yeah.
Apply ivermectin to the wound. I've had like mixed results with that. I'm like,
Yeah, I still throw some in there.
It's-
I don't know how much it actually
I don't know how much it
helps.
actually helps, but I've had like some people are saying like go to the, go buy like a tube of ivermectin and just rub it directly onto the wound. I don't know if that works.
Yeah, again, it goes
I've
back to
injected
like,
some of these with ivermectin,
Yeah.
like that, but I don't know about like putting it directly, like the oral dewormers onto the wound. Some people swear by that though. I've seen that on the internet.
well, the
before.
thing is, you treat a summer sore completely different than you would like a dumb baby.
Right.
Oh,
And
yeah.
Again, this is why you should probably like, I don't know, phone a vet,
Have somebody actually
And-
look at it.
because there's things we can do.
There's a lot of things.
Jar of SWAT, add a small tube of cortisone cream, add about a half cup of Furazone ointment, 1 tube of ivermectin paste, replace Furazone with a half tube of new stock if it's a lower leg injury where proud flesh is an issue. Furazone is not good on proud flesh. Furazone is not good on any open wound.
Really not.
Works great on any wound. We also worm them for summer sores, silver spray. Okay. I'm like, okay. I mean, it's not the worst thing I've seen.
It's probably not. That's
That's okay.
But again, is it a summer sore?
Is it a summer sore?
Or is it just a wound?
The things we're trained to look for.
Yep.
Call your vet.
Call your vet, please.
Oh,
Just got
boy.
a mayor with a stifle click.
Looking for a good joint supplement so we can ride her.
So going to be a breeder. So something that won't cause issues with that. Oh, here we go.
Oh, I would have her
Um,
x-rayed to see exactly what is going on and the best course of treatment. Okay.
Good. Okay.
That's good. Good.
If it's really bad, it requires surgery. If it's caused by an injury, not something in a bloodline, it should be okay to breed.
Well, my question is,
Yeah.
like, it's a stifle click. Is the horse lame or not?
Right.
And then why is and because I mean, here's the thing: a lot of
My
joints.
stifle clicks
click.
all the time.
Yeah. I mean, you can click without there being an issue.
Yeah.
And joint supplement, I'm gonna have to go here. They don't work.
No, they don't.
No, they don't.
Glucosamine, once absorbed, goes to the liver, where everything goes when you eat it, and it's broken down into glucose and an amine group. It never actually gets into the body.
Nope.
So,
Oh boy.
all right.
Air in the joints will make a noise, not necessarily signs of issue.
how do you
air-
get air in a joint?
You have air
I
in
just
your
wanna
joint,
know-
you have a puncture wound, and it's probably septic, and you should probably go.
You
see
got like
vet
a
about that.
puncture wound. You got the bends.
Yeah.
And your horse hasn't been scuba diving, so we'll rule out the bends. I mean, my grandma said, "Oh, you got that air in your joint." Well, you know what?
How did he get there, Grandma? How
I
did he
mean-
get there?
But you know, we learn. We've learned a lot of things. Like I can remember back in the 20s, I think Pall Malls were the safest cigarettes for pregnant women to smoke. We've learned. So, let's.
There's no supplement that will make up for poor genetics, poor feed, hoof neglect, or lack of exercise. Put that on a bumper sticker.
Stifle issues don't typically resolve themselves with a feed-through joint supplement. The joint needs to be x-rayed to find out exactly what's going on with it. It would be helpful to know if it was caused by an injury or if the mayor has a conformation issue. Stifle issues can be tricky, and if it is clicking, then I would hazard a guess that it's probably something that might need to have some surgery. Main thing at this point is to identify the issue. If there is an issue,
There may not be an issue.
there may not be an issue.
There's one that said ground flax is great for horses.
Oh, boy.
I mean, it is great
It
for
is
horses.
great.
I don't think it's going to
Not
fix your
for
stifle,
stifles.
but it is great for horses.
And how do you know it's the stifle clicking? There's a whole lot of joints in that
Oh,
leg. Like,
yeah.
Like, how do you
People
figure out
always
which one?
think,
I love the stifle. It's always the stifle or the shoulder every
I know.
time.
Every time I block a foot, they're like, did that block the stifle?
Oh,
No. Block the shoulder.
Yeah, shoulders and
I've only
stifles.
seen one horse actually block to a shoulder.
I'm fixing to start selling it in my shop after 9 years of use, but have a coupon code you can use to get 5% off your order.
Salty Mustang.
Which is that?
Salty Mustang.
The bottom.
Is that the same girl that was putting the salt in her horse's eye?
She's not spring haltered, is she? A what?
Y'all got any idea?
String halt. String halt. I think he's trying to say string halt.
Yes. Spring haltered
Spring
is.
haltered.
That's what you do in the spring when you get the yearlings up out the back 40. You do some spring haltering.
That's spring halter, didn't you?
And I think this is a good point. Like, y'all, these are the people that are giving advice. We're trying to get them spring haltered.
Oh, bless it.
I haven't even commented on grammar yet. Like I have not even like my little,
I made one misspelling comment, but my tisms are tisming over
No,
here.
like I am kind of a grammar nerd when it comes to things, and I have not even like allowed myself to go into that. But I
Because we
am,
could go on forever.
I'm tweaking out about that over
Oh,
here. Like
man.
that is
Spring haltered.
man. Oh God. Oh my God.
Oh, okay, this is
Oh,
probably-
boy.
All right.
I just oh Lord. Oh God. I'm seeing kissing spine. I'm seeing wobblers all in the same sentence.
I'm wondering what everyone's experience with kissing spine is. How did your horse act? What did you notice that made you think to get it checked out? What was the outcome, etc.? Please only comment if you've had a horse with a confirmed case.
Oh boy.
What is kissing spine? I've experienced wobblers. Oh boy.
I think kissing spine is the most overdiagnosed thing in all of America right now. Every time I look around, oh, he's got some kissing spine. Oh, this one's got some kissing spine. Every time you hear like, oh, he's got kissing spine, it's never kissing spine. Like, and they have some back pain, yeah, but most of the time it's muscle related.
I've seen horses that have terrible looking back x-rays, but they've never been clinical. Their back doesn't hurt. They flex beautifully. They palpate beautifully. They ride beautifully. They have no issues.
You can also make a back look really ugly on an X-ray.
Oh,
yeah.
With how they're standing. You
But
can-
I've also seen horses that are terribly back sore, but their x-rays are beautiful. So like they don't correlate. There's
No.
not a direct correlation between the two.
No.
And you can also get referred back pain.
Correct.
If a horse
Yes.
is painful in a distal limb and they are carrying themselves differently.
Yeah. Just like if you sprain your ankle and you've been walking around wonky for 2 weeks and then you're like, oh, my back.
Your back hurts a little bit,
And
and
I get this a lot, and I try to tell people, it's like, your job's to come here and tell me what's going on. Give me history. It's my job to figure out the diagnosis.
Right.
And I think that's important. Don't sit at home trying to solve this puzzle, right? I mean, my heating and air is not working at home. I'm not over there like trying to like. I don't know anything about heating and air, so I don't call the guys like, oh, I think the compressor's out. I just call them up and like, hey,
Something's not working.
it should be cool in my house and it's not. Come fix it.
Because when you come in with a diagnosis already in your brain, you might not be receptive to what the veterinarian has to say, and you might not get the full benefit of that visit because you're not processing everything. Like,
It's
you
kinda
got to
like-
come in with an open mind.
Yeah, it's kind of like every time I go on WebMD, I've got some kind of cancer, weird autoimmune disease, or
Yeah.
get some
Or
kind
you're
of crazy
pregnant.
pregnant.
Yeah.
I get that one a lot.
Yeah.
Like I start reading through this stuff, I'm like, oh Lord, I've got cancer.
I've got a parasite.
yeah. That you can only pick up in like Southeast Asia, which you've never been to,
No.
but like you definitely got it.
Turns out,
X-ray showed it was in the withers and also further down her back. No chance of recovery, and she was in very bad constant pain. Vet advised euthanasia as it would only get worse. Interesting. Okay.
I think you got to figure out like. I was trying to figure out like I have yet to have a kissing spine case in 15 years looking at lame horses 5 days a week.
And every single one that I've seen after they have like a dorsal spinous process, like resection, they do terrible.
I haven't seen like a great one.
No.
Not long term.
No.
So let's go figure out what the actual problem is.
Yeah.
That's always my goal.
It's probably
We're gonna
not
wrap up this one.
primarily back.
This one was somebody posted with all very good intentions, reasons to immediately call the vet seriously. And it was just this list of like, you know, when like colicky signs, and if you ever find like, you know, your horse is acutely lame or things like this. And someone said, good post, though maybe you should add that if it's something like a nail in the foot, farriers are usually better than vets, as they are more skilled in this area and will advise if extra help is needed at that time.
As a farrier, you call me and say this is back when I was just a farrier. You call me and say there's a nail in the foot. I'm going to tell you to call the vet.
Yeah.
Yep.
We need to know where that nail is.
I don't know of any farrier other than Dan that carries an X-ray generator on their truck.
Mm-mm.
And that's what we need in that situation.
Yes.
I mean, I can AI stuff right now. We'll see what are your common questions.
Yeah, let's.
Can you give Banamine to pregnant mares?
Wow, this one's changed.
This one has changed.
So a few weeks ago, when we typed this in, it said, no, you cannot give Banamine to pregnant mares.
Because it causes abortions in other species.
Yes.
Or can cause abortions. So none of this was concrete answers. It was that they didn't have studies about it, so they didn't know what you could and couldn't do. But you know what tells me what I can and can't do is my doctorate.
Yes.
Use the lowest effective dose and shortest duration possible.
Great.
Yes, that's great. That's going to be true regardless of if the mare is pregnant or not. Prolonged high dose may potentially cause fetal complications, placental issues, or gastrointestinal side effects. Yes,
Yeah.
that's the only one. Should be avoided close to foaling, as it may interfere with normal prostaglandin activity, which is important for labor.
It's not that good.
No, it's not.
It's not that good. No. I think my horse is colicking. What should I do? Act quickly.
Oh, wow, that's good.
Yes.
Yeah, call your veterinarian right away. That's great. Describe the symptoms. Yes, keep your horse safe and calm.
Good. Okay.
If safe, walk the horse slowly to prevent rolling. No, look here,
Do not force them to walk.
no, if they want to lay down, lay quietly, let them lay.
Let them lay down. Their stomach hurts.
Yeah.
They're hurting.
Only give medication if your vet says to.
Correct.
Fantastic.
No, the AI is AI.
Good job, ChatGPT.
We love that.
So
okay, normal vital signs. Rock on.
Okay.
Yeah.
All right.
Okay.
Okay, so ChatGPT so far is winning.
Okay.
Google
All right, let's stump it.
and Facebook zero. Let's stomp it. What you got?
Choke. My horse is choking.
Horse choking. What do I do?
Wow.
Still breathe.
Oh, wow.
Call your vet. Take away food. Keep them quiet. Winner, chicken dinner. I love
Yes.
this.
And we only like it because it's telling you to call your vet.
Yes.
Do not try to flush the mouth or throat. Don't get the water hose.
Oh, please don't waterboard your horse.
Oh, Lord, I see that all
Yeah.
the time. Go back up the top again. Look right here. Keep going up.
Letting them eat or drink can make it
If your
worse
horse
than
is choking,
desperation.
this is an emergency, but not like human choking. Yes.
Good job.
All right, ChatGPT for the win.
ChatGPT.
ChatGPT.
Act fast, but don't panic. Love it.
Yes. Well, I'm kind of impressed. I've never
Yeah.
used ChatGPT. It's my first time.
It's planned half of my wedding, so.
Oh.
Oh, no.
All right, so the question was, my horse has arthritis. What steroids should I give it? Steroids can be helpful. Yes, triamcinolone. Okay, I agree with that one. Not my first choice. Methylpred. Yep, use a lot of that. That's pretty good. Dexamethasone.
Careful.
Never actually put that in a joint.
Can you put that
To
in a
be
joint?
fair, I didn't
I-
You can.
specify it
You
in the
can.
joint.
People put that in
You can put
joints?
Dex-SP in the joint.
Interesting.
It can go in articular. It doesn't work very well, but
I was gonna say, I was like, I wouldn't think it would, but
in a pinch, you
Ooh.
can.
Risks of steroid use: laminitis,
Yep.
cartilage damage with overuse,
Eh,
immunosuppression,
yes.
masking lameness leading to overuse of injured joints.
I don't know if my horse has EPM.
Can be tricky to diagnose, but catching it early is crucial. It's a neurologic disease caused by a protozoan parasite that affects the central nervous system. Okay.
Yeah.
How long until we talk to the vet in this one?
Symptoms. How's it diagnosed? Neurologic exam by a veterinarian. Yes.
Whoop, whoop.
That's probably the most critical thing to do. Mm-hmm. Like, we don't just guess our way through this.
No.
Marquee, rebalance, Protozil. I agree with all that.
Wow.
You got rule outs in there. That's very important if you
28
go
days
up.
or more. Yes, that's important. All these things that you see online that are
You know, what's
advertised
not,
for 10
you know, it's not
days.
in there. Decoconate.
Oh, yeah.
Dequinate.
Anti-inflammatories, vitamin E, and rest.
Yeah.
Don't wait if you suspect EPM. Wow, the AI is. I'm impressed today.
You got the phone, call your vet instead
Yep.
of going to Facebook.
Please.
We'll talk to you on the phone. Your vet's going to talk to you. They're going to help you out. I mean, they're going to tell you, yeah, we need to see that. No, we don't. I think the best source of information is still going to be calling your veterinarian.
Yes.
I don't know that Facebook is where you need to go. If you're not getting results from your veterinarian, I would look for another one.
Yeah.
I would not trust Facebook.
Yep.
So,
So you can see a lot of these people on here have zero credentials and are telling you to put salt in your horse's eyes.
And just please don't believe what Facebook or the AI says over what your veterinarian says. Please.
Yes.
No.
Well, I appreciate y'all being here today. Thank y'all for tuning in. We appreciate it. This is our 50th episode. We're pretty excited about that. And hopefully we got 50 more in us and
What are we
50
going to
more
do for
that.
episode number 100?
Oh, I don't know. We got to think of something cool. If anybody's got any ideas, y'all DM us on what we should do for episode.
It's like the 100th day
100.
of school when
We
you get to like wear your PJs to
Yeah.
school and
Yeah.
like have a
We
party.
go through our phones and we show nasty pictures of things that we have.
That would be
Say,
so
what's
fun.
what's on my phone? What's on my camera roll?
I have so many good things.
That would actually be a kind of a cool
That would
episode.
be
What's
fun.
on my camera roll?
What's on my camera roll?
So, well, thank y'all for being here today. Thank y'all for tuning in as always. April, thanks for putting all this together. Casey, thanks for editing this mess that
It's
we're
going to be a doozy.
Yeah.
that we send over. We kind of go down rabbit holes and trains, and y'all don't actually see that because we got some great people that get rid of all the non-pertinent information. So
Maybe one day we'll have a bloopers episode or things.
Lord.
All the uncut things.
yeah, uncut, uncensored.
Yes.
Bleep, bleep.
Yeah. There's gonna be a lot of bleeping out.
Well, thank y'all for tuning in. We look forward to seeing y'all next time. From all us here at Countryside Equine, y'all have a great week. Take care.